All right. Hey, everyone. Welcome back for another deep dive. We love diving into the nitty-gritty of all things nursing.
Absolutely.
And today we're tackling a topic that's particularly important for all of you future labor and delivery nurses out there.
Definitely a big one.
It's hypertensive disorders in pregnancy.
You got it. We're going to unpack the 5 major types that you'll see and how to care for these patients.
And I know you're all hitting the books hard trying to make sense of this complex stuff.
Oh, yeah.
So we're going to break it all down for you, make it clear, and give you the confidence to provide amazing care.
And hopefully have some fun along the way.
Exactly. All right, so let's kick things off with chronic hypertension. What's the deal with this one?
So chronic hypertension basically means a woman has high blood pressure even before she gets pregnant,
Okay.
or it develops before 20 weeks of pregnancy.
So it's like pre-existing, basically.
Exactly. And that's super important because it helps us distinguish it from other types of hypertension that can pop up during pregnancy.
Gotcha. That makes sense. So if a woman comes in and she already has high blood pressure or it shows up early on, what do we do?
Well, first things first, we've got to manage it carefully, right? We might adjust her medications, but we have to be super cautious about what we give her because remember, mom and baby safety is always the top priority.
Absolutely. So what kinds of meds are we talking about here?
You'll learn all about this in your pharmacology classes.
Okay.
But for example, ACE inhibitors.
Oh, yeah.
Those are a big no-no during pregnancy because they can cause some serious problems for the developing baby.
Wow, yeah. That's a big one to remember.
Definitely. And here's another thing to keep in mind. Chronic hypertension actually increases a woman's risk of developing preeclampsia later on in her pregnancy.
Okay. So that's something we definitely want to be on the lookout for.
For sure.
Speaking of preeclampsia, let's talk about gestational hypertension. How is that different?
Okay, so gestational hypertension is high blood pressure that pops up after 20 weeks of pregnancy, but without any signs of organ damage like we see in preeclampsia.
So no protein in the urine or anything like
Right, exactly. It's just a little warning sign, a little heads up
that? Okay.
that something might be brewing, but it doesn't always mean it will turn into full-blown preeclampsia.
So it's kind of like that check engine light in your car. It could be something minor or it could be a sign of something more serious.
Exactly. You got to pay attention and figure out what's going on.
So for all of our nursing students out there, what are the key things to watch for with gestational hypertension?
Okay, well, obviously monitoring blood pressure regularly is crucial. We need to see if it's trending upwards or staying stable.
Right.
And it's super important to educate your patients about any warning signs.
Like what?
Like severe headaches, vision changes, sudden swelling, things like that.
Okay.
Teach them to recognize these red flags and to call their doctor immediately if they experience any of them.
Got it. So communication is key.
Absolutely. Your patients need to feel comfortable coming to you with any concerns.
Right. Makes sense. All right, so let's move on to the big one, preeclampsia.
Okay, so preeclampsia. This is where things can get really serious.
Yeah, I remember learning about this in class and being like, whoa.
It's definitely a game changer.
So how do we know if a pregnant woman has preeclampsia?
Okay, so it's basically high blood pressure after 20 weeks.
Okay.
But now we're seeing signs of damage to other organs.
Ooh, okay.
Like the kidneys or the liver.
So not just high blood pressure anymore.
Right, it's affecting the whole body.
Yeah.
And one of the key signs is protein in the urine.
Proteinuria.
Yep, exactly. And the symptoms can be pretty scary too.
Like what kind of symptoms are we talking about?
Think severe headaches, vision problems, sudden weight gain, swelling, especially in the hands and face.
Oh, wow.
Yeah.
That sounds pretty serious.
It is. And that's why close monitoring is so important.
Okay.
We may need to hospitalize the patient. And in some cases, the best way to protect both mom and baby is to deliver the baby, even if it's premature.
Wow, so it can be really intense for those new nurses out there.
It can be, but remember you're not alone. You'll have a whole team of experienced nurses and doctors to support you.
Right.
And don't be afraid to ask questions, even if you think they're silly.
That's great advice.
Yeah.
All right, so now we've got to talk about eclampsia, which is like preeclampsia's even scarier older sister.
It's true. Eclampsia is basically preeclampsia plus seizures.
Oh, wow.
It's a life-threatening medical emergency.
Yeah.
And we need to act fast.
So what do we do?
Okay, so first we got to control those seizures.
Okay.
Typically with magnesium sulfate.
Mm-hmm.
And then we need to deliver that baby as soon as it's safe.
So it's all hands on deck.
Absolutely. Every second counts.
Okay. And then last but not least, we have chronic hypertension with superimposed preeclampsia.
This is a mouthful.
It is.
But basically it means a woman already had chronic hypertension.
Right.
And then she develops preeclampsia on top of that.
Oh, wow. So it's like a double whammy.
Exactly. And it can be really challenging to manage.
Because it just increases all the risks we've already talked about.
Exactly. The risks for both mom and baby are much higher.
Okay, so we've covered all the different types of hypertensive disorders in pregnancy.
We did it.
But what can our future nurses out there actually do to help these patients?
Great question. So many things.
Okay.
But one of the most important is blood pressure monitoring.
Yeah, I bet.
It seems simple, but it's not just about taking a reading and moving on.
What else should we be doing?
You're looking for trends.
Okay.
Is the blood pressure steadily increasing? Are there any other symptoms popping up? It's like being a detective. You're gathering clues.
I love that analogy.
And then, of course, patient education is huge.
Totally.
You got to teach your patients about the warning signs, what to watch out for,
Yeah.
when to call the doctor, how to manage their condition. It can literally save lives.
Absolutely. Knowledge is power.
It really is.
What about medications? Are there any special considerations for pregnant women?
Oh, tons.
Okay.
Some medications are perfectly safe during pregnancy. Others are absolutely off limits. So you need to know the ins and outs of medication safety.
That's where pharmacology class comes in.
Exactly.
And of course, we can't forget about the baby.
Never.
How do hypertensive disorders affect the little one?
Well, they can definitely impact fetal growth and development.
Okay.
So we need to monitor the baby's health very closely.
So we're using things like ultrasounds and fetal heart rate monitoring.
Exactly. We want to make sure the baby is growing properly and that there are no signs of distress.
This is a lot to take in, I know.
It is.
But for all of you future nurses out there, just remember, you're not expected to know everything right away.
It's a journey.
It is. And you'll learn so much on the job.
Absolutely. So much.
But by understanding the basics of these hypertensive disorders,
The different types, the signs, the symptoms,
Yeah.
the treatments, you're already ahead of the game.
right, you're well on your way to becoming incredible nurses.
Exactly. And remember, you're making a real difference in the lives of these mothers and their babies.
Absolutely.
Right.
What a rewarding field to be in.
It really is.
All right, that's it for this deep dive on hypertensive disorders in pregnancy. We hope you learned something new.
We hope you enjoyed it.
And we'll see you next time for another deep dive into the world of nursing.
See you then.
Bye, everyone.
Bye.